Shoulder relax. Good, nice and light. Perfect. Good. And as always, don't just mask the symptoms. There's so many things, over-the-counter things, prescriptions that can just take the inflammation and pain away. And we think that okay, I got Kimberly in the office. Kimberly is being treated for an automobile accident that she had almost exactly a month ago. So she came in a lot of pain. We're slowly getting better. It's basically her whole back, neck, hips, mid back, low back, ribs. You got rear-ended, correct? Yeah, from behind.
Yeah.
So any auto accident injuries, anything like in terms of a fall or more major falls or accidents, especially from auto, your adrenaline. Good. So just very still tight through there. So we're just trying to gently get some motion into these vertebrae. Start the healing process, start the rehab process. And she's been responding well, but again, from an injury like she had, it takes time. Again, just more muscle work. I'm not going to do too much on the video. We'll do more after, but I'm starting where those muscles insert to her ilium, where they originate rather, and then where it come all the way up to where they insert onto her lower thoracic, even the bottom of her rib cage through here. And as always, don't just mask the symptoms. There's so many things, over-the-counter things, prescriptions that can just take the inflammation and pain away. And we think that we're better, but you're left much worse off because you never got anything to heal correctly. You never fixed anything at the original root cause. You kind of just, took an over-the-counter thing to reduce inflammation, and you're left with a lot of old injuries that can cause problems over time. All right, just some light traction here. Slide down a little bit for me. Good, right there. Really just trying to work out your low back, stretch your SI, stretch your lumbar joints. Allow these joints to heal properly. Good. Just a few, nice, easy. One more. Last one. Good. Okay, Kim, go on your back. Go on your side facing me. Deep breath. Exhale. Good. Other side for me. Keep going, keep going. Good. Deep breath. Exhale. Good. On your back. Slide down just a little bit. Okay, cross these arms. Deep breath in. Exhale. Come on back. Last one. Good. Let's get her neck adjusted. Okay, real nice and light here for me. Kimberly, get that shoulder relaxed. Good, nice and light. Perfect. And this one. Moving already. Good. Pick those knees up for me, a little traction, and you're done. Excellent. Pick your head up. Good, can't let it drop down. Don't pull, so just a nice easy stretch for her neck. Not being aggressive with a really strong extra pull. We're just trying to, sometimes we'll get a little release in there, but just taking pressure off the disc, taking pressure off the shoulders and trap muscles and the base of the neck. Kind of pulling that skull off of her C1 vertebra. You okay there? Mm-hmm. One more. Okay, that's it for today. We'll probably do a little more soft tissue work on her shoulders, but that's the basic visit. Thanks.